All right, so this chapter is chapter 12, Antepartum Fetal Testing. Firstly, when do you start antepartum testing? Well, the purpose of antepartum testing is to identify if there is problem with the fetus, and if there is, to deliver the baby, and so to prevent intrauterine death. Is there any point in assessing the fetus prior to viability? Answer, probably not. What is the gestational age of viability? If we look at what is the most significant organ system in terms of survival, it is the lungs. Prior to 24 weeks, there isn't any alveoli, even in the fetal lungs. So prior to 24 weeks, probably doesn't make any sense. Let's look at our patient here in this case. A 37-year-old multipara with systemic lupus erythematosus is at 31 weeks gestation. Does she have any risk factors for concerns about the fetus and its well-being? Number one, systemic lupus, vascular disease, decreased placental perfusion. She also has chronic hypertension being controlled by methyl-dopa. There is a second risk factor. She comes to the office stating her fetus is not moving as much as it used to. Decreased fetal movement. That's probably the most common indication for antepartum fetal testing. Let's look at where we're going here. The most common antepartum fetal test is the NST. If it is reactive, we just repeat it as needed. If the NST is non-reactive, we do a vibroacoustic stimulation. If it becomes reactive after that, that's fine. Well-being has been established, repeat as needed. What if it is non-reactive even after the vibroacoustic stimulation? Then we go to the biophysical profile. If the biophysical profile is 8 or 10, excellent. Repeat as needed. If the biophysical profile is 0 or 2, das ist nicht gut. This baby needs to be delivered. If the biophysical profile is 4 or 6 intermediate, that would be the indication for a contraction stress test. A negative contraction stress test is what you'd like to see. Repeat as needed. If you have a non-reactive NST, biophysical profile 4 or 6, contraction stress test positive, that's time for delivery. We start with fetal movement counting. Now, fetal movement counting is not a very good predictor of fetal well-being. Now, we always ask patients, how's the baby moving? And the cardiac kick count says, how long does it take to feel 10 fetal movements? It's not adequate for primary fetal screening in a high-risk population because half the time when the fetus moves, the mother doesn't even feel it. On the other hand, I've seen times when on ultrasound I diagnose a fetal death. There is edema, there is ascites, and the mother says she felt the baby move in the waiting room. So, not very specific or sensitive. The most common reason for antepartum fetal testing is decreased movement. If you have decreased fetal movement, what's the next step in management? NST, non-stress test. We'll talk about this. What if the mom says, I haven't felt any fetal movement for the last 2 days? That's when you go directly to ultrasound. And what you want to look for is there cardiac motion? NST, decreased fetal movement. Sonogram, no fetal movements.